out.
Only thing I care about this whole conversation is what you just said right there. You said you were committed, so do it, and then let me know.
Yeah, that makes sense.
That's a good leadway into this episode.
Boom.
Dr. Rhett Polka, 180 System.
Do you know how to polka dance?
I actually do not.
How many times have you heard that in your
I was
life?
going to say that's really
Once or
probably,
twice.
Once or
probably
twice.
not original.
Dr. Rhett came out, one of Jim's buddies, known him for a while.
Absolutely.
We're done with the Train with Rich weekend. He kind of came out on, you got here Saturday, well, Friday night, but saw you Saturday morning.
Yep.
Did some manual therapy type stuff, some warm up stuff, some cool down stuff.
Muscle
Showed
activation.
some cool things. So I don't know. We can talk about what's your I guess background. Ellie, we'll let Ellie kind of. She's the one that kind of deals.
Yeah, just tell us about what you do first.
Okay, Dr. Rhett Polka. I'm a physical therapist in Colorado. I have 2 clinics there, one in Loveland, one in Denver, and I've been doing physical therapy for 18 years now. Opened the clinic 13 years ago. We've been patent pending with the 180 system for 4 long years now.
4 years.
Yeah, it's ridiculous.
Is there a light at the end of the tunnel?
Every time I think it's done, we get some other goofy curveball. So now we're defending ourselves against basically Mother Nature. We're trying to prove that what we do wouldn't naturally happen by itself if nobody did anything. So it's kind of ridiculous.
Yeah, I'm lost already.
Yeah.
We
know what you
believe
just
in
said.
you. You're going to get through it. It'll be fine. Wow. So tell us a little bit about the 180 system itself. I mean, you just showed me, and my mind is blown. But can you articulate a little bit?
Yep. So every time we see somebody, whether it's an initial evaluation, a follow-up visit, we always start with the functional screen. So how I had you squat, stand on one foot, squat, watch you walk, all that kind of stuff. So what we want to do is try to figure out what's wrong with people functionally, why they can't function normally. So when people come into me, they think they're coming in to see me because they have pain. I think, or I know they're coming to see me because they're dysfunctional, and the dysfunction is what causes the pain that brings them into me. So I tell people that some people get caught up on pain, and I basically tell them, I don't care if you don't hurt, because I could do a whole bunch of things to take away your pain that wouldn't solve your problem. Mm-hmm. I would rather solve your problem, and that takes away your pain, so you don't have to keep on coming back to see me. So every visit starts with a functional screen from head to toe. So if you come in to see me with migraine headaches, I'm still going to have you take your shoes off and assess your feet. So we run everybody through the screen. That tells us functionally what you can and cannot do. So I'm looking for you to break down somewhere. So if you can't single leg squat because you can't control pronation and you've got low back pain, that tells me when I put you on the table, I'm going to start with your feet and your knees and your hips before I ever get to your low back. So the screen sets up what we do on the table. Once I put you on the table, I'm already thinking of certain positions that you failed at in the screen. All of those positions correlate with certain muscles. If muscles don't stabilize joints become unstable, you compensate, overuse other things, and bad things happen. So when I have you on the table, I'll start testing muscles with what we call neuromuscular facilitation tests. So typical physical therapists will use what's called a manual muscle test, which is they're testing gross strength. I'm testing whether the muscle can contract. Okay. So like with Rich yesterday when I worked with him, if I say Rich's quads are inhibited or don't work, somebody would be like, are you crazy? It's Rich. He can squat, he can clean, he can do all this crazy stuff. How can he not be facilitating his muscle? Well, because he's a great athlete, he's figured out, or his body has figured out how to compensate for what he can't do. So when I put you in positions, you can't stop me, no matter how hard you try. That tells me that it's not a muscle problem, it's a nerve muscle problem. So the problem is that the nerve is not getting the stimulation or the appropriate stimulation to the muscle to make it contract on demand. So if you can't contract on demand when I have it on you at a table, you can't contract on demand when you're running, going upstairs, all that kind of stuff. So once I find a muscle that fails the test, I go to the proximal and distal muscle belly, which is where the neuromuscular junction is. So neuromuscular junction is basically where the nerve comes and meets the muscle to turn things on. And those are throughout the entire muscle belly. So what I figured out through playing with things is that if I irritate the proximal and distal end, that will turn on the rest of the muscle. So what I'll do is irritate that, like when I was poking around on you, then I'll come back and retest the muscle. The same test that failed the first time should feel strong. So like Rich had one yesterday where I went to test it. I'm barely giving him any pressure and just sent him through the roof. So that tells me that muscle is not contracting, and that's what this knee pain is stemming from. So once I come back and test you again, and the second time you can stop me, then I say, okay, I know that one works. Now, what other muscle works with that muscle in that position that you failed? And I keep on going through and looking for more failures. So every time something fails, that means it's inhibited or the muscle can't contract normally. Turn it back on, retest it. And then after I go through everything, then we get you back off the table and retest the functional screen. So if you couldn't single leg squat before I got you on the table, once I get you off the table, you should be able to single leg squat, no knee pain, no falling into pronation, good stability, all that kind of stuff.
So is what you're saying, like, is something failing the same as, like, I told you, like, hey, my hamstrings are bothering me, and you're like, it's actually a lack of firing in the opposition, the quad. Is that the same thing as you're saying, like, a muscle's failing? I thought that was just interesting that you were saying it's generally, can you explain that, the opposite of?
Correct. Okay. So it's called the law of reciprocal inhibition. So basically, when one muscle contracts, it sends a message through your spinal cord to the opposing muscle that runs through what's called an inhibitory interneuron. That tells the opposing muscle to contract less. So with you, if your quads aren't contracting and you're trying to sprint, your quad is supposed to pull you forward in the sprint. If your quad doesn't contract to pull you forward, nobody tells your hamstrings, hey, I've got control of this, you can let it go. So your hamstrings freak out and say, no, I'm not going to let you do that, which irritates your hamstring. So for all these years, you've been working on hamstring stuff. Well, your problem has been your quads and a little bit of glute stuff too, but primarily your quads, which is what we see all the time with athletes that pull hamstrings. So when I get football players from the colleges in the area and they've got hamstring problems, and they had a hamstring in fall ball, and then they had a hamstring in winter conditioning, and then they got a hamstring in spring ball, and they've been going to the training room the whole time, the first thing I say is, what have they been doing with your quads? And they'll be like, what do you mean?
So what led you to, from, like, conventional physical therapy or the way you were treating people, to just one day say, I'm going to create this patent pending system? I mean, that seems like a pretty huge endeavor.
So I got out of school, and funny thing is, so I grew up in Loveland, went to undergrad, went to grad school, came back to Loveland, and got a job in the clinic that I went to rehab for when I had injuries when I was in middle school and in high school, and thought, oh man, this is going to be so cool. There's going to be so much cool stuff going on now. So when I was in ninth grade, 1989, I tore my piriformis. Went through rehab, thought this is really cool, body, crossover with strength and conditioning and athletes and all that kind of stuff that I was into. So when I got out of school, I was like, oh, this is going to be so awesome. Everything's going to be so different. And went back to work at that clinic, and everybody was basically doing the same thing that they were doing in 1989, and now we're in 2000. So I was like, I can't... I didn't spend 7 years in college to do this stuff. So I was getting good results as far as, conventional PT went. So I'd see patients, they liked me, they felt better when they left. I'd see them for the follow-up. They'd say, oh yeah, I felt good for 2 days, and then things came back. And it was this just never ending. People felt good for the short term, but never good for the long term. People felt good, but not good enough to go back and do what they were doing before. So they still couldn't function the way they wanted to. So I basically came to the realization I either needed to figure out a better way to do it and figure out if there was a better way. And if there wasn't a better way, I need to go flip hamburgers or do something else, because I was just driving myself just crazy. So I basically locked myself in a room, took all the books that we had in college, and just started combing through all this stuff. And things like the law of reciprocal inhibition, it was something that you learn in school, but you don't learn how to apply it. So there's no application. So you get out of school and you see the physical therapist that's been there for 10 years doing something, and you go, well, he's been doing it for 10 years. I should probably do the same thing. So I knew there was a massive breakdown there. So once I started to piece things together, I went and started taking more continuing education courses, try to figure out who was in the know in the industry and functional type stuff. So started taking any kind of functional exercise course or screening course, that kind of stuff. So a lot of what the 180 system is bits and pieces that I took from other stuff and stuck it together. So it's not that I invented something. I just took pieces of what other people were talking about and figured out how to make it reproducible with everybody. So it's not something that only works with elite athletes. I see grandmas, I see little kids, I see work comp, I see auto. It works with everybody because at the root of it, it's based on physiology.
So how did you, was this something you learned or that you were taught at some point, that applying pressure to a muscle belly refires the neuron? Correct me if I'm saying this wrong. I'm just taking what I thought I heard you say.
You're pretty good. Yep.
How did you figure that out? It seems so, because something hurt so bad and you literally walked up, applied pressure, and the pain went away.
Yep.
That it's mind-blowing.
So a lot of trial and error. There's other techniques that are out there that people are putting their hands on somebody to try to get things to either relax or lengthen or that kind of stuff. So I started playing with manual therapy type stuff and thinking, okay, if this works and this works, then there's got to be something else that I can, add to this or morph this into.
What are some of the differences between what you're doing and what a normal PT would be doing?
So we talked about this a little bit today. You were talking to Dr. Goddard that was on before, and he asked if I put my hands on people, and you were like, well, doesn't every physical therapist put their hands on people?
Right.
And they don't. Unfortunately, physical therapists let constraints with insurance and time and payment and all that kind of stuff kind of dictate what they do with patients. So when I see a patient, I'm hands-on with them for 20 to 30 minutes. So screen, hands-on manual therapy, rescreen, and then if we've got time, then we go in the gym and we play. So I've got a 1,200 square foot gym at my facility with turf and bumpers and squat racks and all that kind of stuff. So we can go actually test. So like with Rich yesterday, I don't want to just work on him and say, okay, now my squat feels better. I want him to go work out and do what he does to make sure that feels good. So we do a lot of that stuff at my clinic. So conventional physical therapy is still focused and very tunnel vision on where's the symptom, where's the pain, where's the tightness, let's get rid of that stuff.
You go in there and they give you an exercise and you do it.
Yep.
And then you do the next exercise and they put you on the bike and then they put some stem on you and then you go home.
Yep.
And they never really once ever put their hands on you or
or they might put their hands on you and do massage or myofascial release, that kind of stuff, which is the opposite of what we're doing. So we're trying to make the muscles contract. They're trying to make the muscles relax.
Right.
So when I talk about this stuff with patients, I talk about what's called mostrability, which is the combination of motion, strength, and stability. So the problem is, if I just look at you as a limited motion type person, I want to give you motion. And that's where some breakdowns can occur, because if I give you motion that you can't stabilize and you're not strong enough to get out of, now you're going to fail even worse than you did before, and I'm covering up more symptoms. So it was interesting. I was talking to another physical therapist that I was interviewing for a job that we had open, and I sent him a bunch of videos and said, this is what we're about. If this makes sense to you and you're in for this kind of stuff, fantastic. We'll follow up with the second interview. If you want to go down a different road and you're into the stuff that we don't do, then go ahead and go do that. So talked to him after he watched the videos, and he said, it's really interesting. This is the only thing that I've seen that's actually trying to increase muscle firing, where everything else is trying to decrease muscle firing or do some kind of release. So anything that releases something is making it turn off. We're trying to turn things back on so that you're strong and stable on both sides of the joint.
Makes sense. So in working with other physical therapists before, something that helped me, but in a different way, is talking about activation. I feel like a lot of physical therapists talk about muscle activation. So I'll use the example of I always say my hamstring insertions are,
always, every day.
It's true. I'm not
lying. If I had $1 for every time I've heard that.
Millionaire.
But did you at least, you know what that is? Made you look it up, right? Or you already knew?
I have an exercise science background.
Good.
Unlike some colleges, we actually had to attend class in mid-grades.
Who are you talking to? I attended class sometimes.
You have no idea anything about
you didn't I didn't tell Jim my story.
Yeah.
We need to get to that.
Yeah, he should.
Yeah. Is this when you were being educated in the Swiss Alps?
I'm coming back to my activation question.
Okay.
When you were picnicking in the Alps and...
Yeah.
No, this doesn't have a happy ending, Jim, okay? This
sorry.
is real
This
life.
has a happy ending.
No.
Great.
Listen, this is what this podcast is about, getting to the truth, so let's get there.
So I was you can't have athlete dorms, but technically I was in the athlete dorm at Florida, which is like offset over here. And you had to, I wasn't cool enough to have a scooter yet, so I had to bike. And for cross-country practice, it was probably a couple miles away, but practice was at 6 a.m. on the golf course, so it's still dark. Why are you laughing?
6 a.m. in the golf course, on the golf course.
Stop. We were running. Anyway, and the University of Florida has a bat house too, which is super creepy, and they fly out for the night and they come back in. So anyway, I had to go straight from practice to my full day, and I couldn't get back over to the dorms because it was a little bit off
Because you weren't cool enough to have a scooter.
I wasn't there yet. That was the next year. Okay. Anyway, so I get my backpack, then I have my gym bag, and then I have my other bag. And then I thought for some reason, this is like when laptops were, I'm not that old, but whatever. I had a really big laptop. So then I had a bag strapped across me. So literally I'm on my bike in the dark at 5:45. I go past the bat house and I have to take a hard hill to get to the track.
There's not many hills in Florida.
It's kind of steep. Anyway,
kind of steep.
It's still dark, but this hill is on frat row. So at 5:45, I mean, they're just coming back.
Okay.
So I'm going up the hill. I'm sweating bullets. I've got bags hanging off my body, and all I hear is, "Why don't you get another bag, nerd?"
Oh, that's where this comes from.
Horrible.
So good.
I was so angry. And what can you do? And it was in slow motion because I'm up a hill. I can only go so fast, and they're just taunting me.
Yeah.
A bunch of frat boys just taunted me at 5:45, and I couldn't even fight it.
So that's where that comes from.
Another, to piggyback off this,
okay.
The other day, we'll get back to activation in a second. This is what happens.
He's good.
And so we're talking about, horrible jobs we've had in the past. Because I don't remember, we were talking about Nick and Angelo, or I can't remember.
No, it was Tasia and Kristen and Lindy were all just talking about first jobs.
First jobs, or jobs that were not so
Your
pleasant.
worst job.
Yeah. Right. And so I was an exterminator for a while. I crawled in crawl spaces and did all that stuff. You know what Ellie's was?
What?
I was a bartender at the country club at the golf course.
I worked in the snack bar so I could have a free golf membership because I golfed every morning.
The snack bar.
It doesn't even snack bar at the golf course.
Holy smokes.
I said, that doesn't count.
One summer, I actually just carried bricks around for the whole summer. They tore down this giant grain silo, and I literally put bricks in a wheelbarrow and hauled them for 8 hours a day.
That sounds.
She's working at the snack shop.
My dad, if I didn't, couldn't find something to do outside, he'd be like, "Hey, there's a stack of cinder blocks in that barn. I want you to put it across the street in the other barn." I finished that. The next day, he goes, "I want them put back."
Wow. One spring break,
I get you a brick trophy.
I literally in this giant warehouse mopped forklift tracks for a week. They had some bigwig coming in to do a.
What was your worst job?
Construction in the summer for my dad. Yeah.
I washed and waxed houseboats in the middle of the summer while everybody else is going out on houseboats. I washed them and waxed them for people.
Tip of the hat as they went out.
Hey, you guys have fun. I'll stay here and take care of your stuff.
The snack bar got a little chilly sometimes.
Shut up. Chili was something you served.
What'd you do? Have to drive around in your snack bar cart? What'd you do? Get good tips?
Yeah.
They were great tippers. Guys at the golf course.
Of course, a blonde.
I remember. Of course they were. What do you think you were driving the snack mobile for? Cute blonde girl?
Right? Because of your brains?
My brains are fine.
Wow.
I washed and waxed a houseboat on a ladder in a John boat.
Wow.
On a ladder?
Yeah.
That's not safe.
It's not safe.
Are you serious?
Oh, yeah. No.
How did you stabilize the boat?
You don't. You fall off every once in a while.
What's the grossest thing you found while you were exterminating?
Dead rats.
Ew.
You're crawling around in chemicals. You're worried about Red 40. I was crawling around
That's why your bones are so dense.
That's what it is.
Did you know Rich has a 4-point-something bone density?
I've heard
He's
that,
a raptor.
Yep.
Like a raptor.
I assume that they have dense bones.
Are dead.
Listen, get another bag, nerd.
I should have never told you.
Oh, man.
Anyway,
muscle activation.
Sorry. So we're going back to just conventional, seeing PT. This is something that helped me. So with the whole hamstring insertion thing, I would frequently tweak it, trying to pull maximal loads or really heavy loads for volume in that exact same spot. So the PT gave me, apply, lay on your back, apply pressure, one leg, someone holds it, resist you, push it back. And that actually helped strengthen it. So now I don't tweak it as often. What are your thoughts and views on things like activation? People say that constantly, and that's a new thing in the CrossFit spaces. We're activating.
Yep.
Can you talk about that? Does that have any relationship to what you do? Is it opposite of what you do?
So with that, there's a couple of limiting factors. One is there's no person watching you assessing function to figure out where you're breaking down first. Then there's no way to put you in a position to actually figure out which muscle needs to be activated. So that's why I had to put together the screen and then figure out how to test it and then go and activate things. So what they were doing with you was isometrics, or they could have been doing contract relax PNF type exercises. So, but remember the important thing that they missed is your hamstring wasn't the problem.
Well, I'm in 100% agreement. Like, it made it stronger, but it's not. It's still painful constantly.
Right.
So
because it's still overactive, because it's still compensating for something else that's not working.
For the not
so they didn't figure
quads.
out. So we talk about root cause analysis. We want to find out what the root cause of the problem is. So the root cause with you was more quad insufficiency than hamstring. So you can do all the hamstring you want, and you can get that hamstring.
But you're still going to be
hamstring just takes the brunt of
doing
it.
twice the work.
Yep. Plus, your glutes weren't doing too much either. So your hamstring is not getting the reciprocal inhibition response from the quad, so it's tight from that. Your glutes aren't working, and hams and glutes are synergists. So instead of your glute doing what it's supposed to be doing, it's telling the hamstring, "Hey, take over for me," and the hamstring is basically just getting picked on nonstop.
So do you train other people to do this? How is everyone going to get? They need this.
Yeah. So that's the big push for this year, is getting me out of the clinic and like replicating myself. So so the 180 system is something, the patent is still pending, but we can go ahead and teach where, it's protected and all that kind of stuff. So that's the big push for 2018. And on the way here, I was talking to a clinic in Arkansas to get things started down there, so we'll be hopefully teaching them there in a couple months, and kind of piggybacking off that. So I know I talked to Jake with you guys, who's in PT school, and he's like, "Yeah, I'm definitely into this. I want to learn more about it." And then it's like, well, if you can figure out if your school wants me to come down, or if there's other people, we can come down here, because what I want to do with Mayhem is figure out how to get somebody here on staff that's here, so I don't have to come down once. Or
you don't like Cookville?
You're gonna move here?
I don't think my wife and kids like Cookville that much. So yeah.
Let's talk about specifically, having you come here, to work on him. Let's talk about what you've done, how things got started, what that all was with him specifically, because I think that's instructive.
Yeah. So Saturday morning, first time I'd worked on Rich, found some stuff that definitely made sense with the knee problems that you're having, because you have problems on one side that are different than the knee problems that you have on the other side. Right. So once we got Rich on the table, run through functional screen, and he actually is pretty good with the screen. Knee pain, a little bit of knee pain with some of the screen, but overall functional movement patterns is pretty good, which I expect because he's an elite athlete, and elite athletes do a great job of compensating.
Did the one firing butt cheek have any relevance? He could only fire one butt cheek while we were doing this earlier.
Yeah. So the cool thing is
weird. That's really a weird thing to say.
It's anatomy. Sorry.
Yeah. So with Rich, we found something. So on his left side, he had problems facilitating rectus femoris and vastus lateralis. On the other side, he had problems facilitating vastus medialis and intermedius. So two different things, which is what we want to see. On one side, he had a lot of hamstring insufficiencies. On both sides, he was glute max. So we don't want to see the same thing happening on one side, or just things all over the place. So the good thing with Rich is everything was pretty much from the waist down. So I didn't find a bunch of shoulder stuff. I didn't find a lot of trunk stuff, neck stuff, all that. So a lot of athletes that come in, like if I take a baseball pitcher, if they come in with a shoulder problem, I'm looking down low first, because if you can't stabilize from the bottom up, then this becomes a problem. So with Rich, his was pretty much from the waist down. So I'd say the first time I saw him on Saturday morning, we probably worked on like 17, 18 muscles. He went and did 2 WODs, went full speed, did everything he could. Actually, I think your clean and jerk that morning was okay over what he was doing. So come back and put him on the table. When I put him on the table after he did the 2 WODs, I actually treated half of what I treated in the morning session, which is good, because it meant that his body, now that we let it work the way it's supposed to work.
That's what you were saying. Okay, now I understand.
Yeah. So now that he's actually using it, his body's saying, "Oh, this is the way this is supposed to be." So we only worked on half of that stuff. Then when I came in and saw him this morning, we probably worked on half of what we worked on the second time. So every time I see him, the amount of work is getting less and less and less. So the key thing is that I forgot to mention. So the key one of the key parts of the system is after we plug things in, you have to go exercise. So basically, nothing that I do on the table is functional. So you're not going to hold on to that stuff, especially if you've had a problem for a long time, because your body thinks that your compensation pattern is the way it's supposed to be. So as soon as I take away that compensation pattern and have you use it the way it's supposed to be, things fall in place. So with Rich, once I give him the ability to facilitate the right muscles, his body says, oh, this is a lot better. So that's why it's easy to work with healthy population, athletic population, elite athletes. Those are the easiest people to work with because they maintain things. Whereas if I've got an 80-year-old lady who's got 2 lumbar fusions and a total knee and she's having hip problems, it's going to take her a little bit longer than one visit for everything to come back together.
Now, what do you see? So we talked, I kind of know the answer, but just to answer, if somebody has a question, what turns stuff off? Like, how does that happen?
So we talked about how I've done 2 pilot studies with the 180 system, and one was I went to a CrossFit gym and had run them through their WOD. They went through the whole WOD, and I had what's called a handheld dynamometer. And the dynamometer reads foot-pounds of pressure. So after their WOD, I had them come over and I just checked one of the quad muscles. Got the reading with the dynamometer, then went through, did our manual therapy technique, and then rechecked it. So after just treating one muscle, which takes 5 seconds for me to poke around, their quad facilitation went up by 15%. So fatigue is one of the things, and overuse is one of the things that's going to make the muscles turn off. So muscles are only supposed to contract and work for so long. So you have fast twitch muscles, slow twitch muscles.
Right.
So once they fatigue, they turn off. They need to be left alone to recover. So fatigue, overuse is one of those things. Another thing is swelling. So we talked about with Rich's swelling. So as soon as they're swelling, the muscles, first thing that does is turn off. So with Rich, it's good that he's already mitigated a lot of that swelling before I ever worked on him, because now that we get things to fire, we don't have the swelling just coming back and returning things back off. So those things are the things we can control. Malnutrition, as long as you're eating well. The guy from RP was here, and nutrition is clean, so that helps out. What else? The other thing that you can force muscle to turn off, so stretching, massage, foam rolling, that kind of stuff also turns the muscles off.
Turn it off?
Yep.
Ooh.
So
it relaxes them, right? You talked about it relaxes them,
right.
So that's turning them off.
Yep. So the other study that we did with the dynamometer was we had some athletes come in that were not post-workout, so just walk in off the street, just see what their strength is in their gluteus medius. So we want to see what happens when you foam roll. So I can give you stacks and stacks of research that will show you that stretching decreases athletic performance, increases injury. Same thing with massage, because you're turning the muscle off. So people want that quick fix. They want that tightness to go away. They want more range of motion, but they're sacrificing strength. So
are you saying, and this is really controversial, and this is good to talk about, because there's a lot of people in the CrossFit world are using that.
And kind of also to kind of, I don't know, like when you're talking stretching, you're saying just end range static stretching. Because like some of the stuff, the exercises you had us do, we are stretching, but you're controlling through the range of motion.
You're controlling the range of motion instead of somebody pulling your arms back and holding your arms back.
Yeah. So it's functional. I don't want to say, I don't know, lack of better term.
Active range of motion.
Yep.
And the other thing you talked about was wanting to get in range.
In range.
You want to get all the way through that.
Yeah.
But you want to be active in those end ranges.
Right.
Yep.
So this is actually the main question I have moving forward. Where does foam roller, the lacrosse ball, all of that fit? You're saying that it doesn't, or where does it fit?
So let me finish up on the study first. So what we did was we had them come in. We checked, before we did anything, just checked gluteus medius strength with the dynamometer, got a reading. Then gave them a foam roller and said, okay, go ahead and foam roll your IT band. So we told them, only foam roll IT band. I don't want you up on the gluteus medius. So they foam rolled IT band 10 times, brought them back, rechecked strength. So we rechecked strength of gluteus medius, which they did not roll, but is
downrange,
but has a attachment component to the IT band. So the second reading that we took with the dynamometer, their strength went down by an average of 24%. So if that muscle can't contract to stabilize you, it also gives you more range of motion, which is why people foam roll. They want to get more range of motion. So you can get more range of motion by either making muscles weaker or not contract, or you can make that range of motion bigger by making them contract and go through and stabilize the range of motion. So I would rather give you strength, which gives you stability and gives you maximal range of motion. So range of motion is a must. So I would never say to somebody, you don't have good range of motion, but I don't want you to stretch, so don't stretch.
Right.
So with Jim yesterday, he asked about how he puts the foam roller behind him,
Right.
or the ball, something like that.
I take a foam roller when I'm starting, and I put it behind my back, and I take a med ball and put it on my chest, and then I arch my back and I roll through that, and I'm moving through that, and for sure I feel better. I don't know if I'm doing myself a favor, but
the key word is you were moving through it.
Right.
So you're controlling the range of motion. So if you're on a foam roller because you're trying to increase your thoracic extension, so you're on that, you're using a med ball here to give you some weight to push you over. So as you're doing that, you're moving, so those joints are moving, and you're moving up and down that foam roller.
Shoot, this is what we talked about then. This is like one of those exercises that's arching the back,
Right.
which is the opposite of when I'm snatching. I want to stabilize and be straight.
Yep.
So what I've done is fire those muscles.
Right. So you're facilitating the motion. So you're not sitting there on a foam roller and just rolling back and forth and trying to just jam out a muscle knot.
No. So that's actually what I'm doing. I'm arching my back, and I'm firing that muscle, which is the opposite of the one that I'm using.
It's tight. Yep.
When I'm snatching. So it's working and helping me stabilize in that motion.
Yep.
Am I saying this right?
Yeah.
Does that make sense?
Yeah.
So same thing like when we ran through the active warm-up today, and I had you guys toe touch before we did the active warm-up and toe touch after. Your toe touch was easier, less hamstring tightness, less low back tightness after you did the active warm-up, and you got rid of, so I mean, I talk to people that foam roll for like 10, 15 minutes.
Yeah.
If you can do an active warm-up that's going to make you stronger and more stable and give you the range of motion in 5 minutes, why wouldn't you do that instead?
That's going to make your body feel better anyway when you start moving, too. And you said you would advocate like a flow yoga.
Yeah, yoga's because yoga, Pilates, all that stuff, because you're getting in and out of end range of motion and your muscles are contracting to do that. So as long as you're doing a flow yoga, power yoga, where you're continuously moving, that's fantastic because you're getting, just not.
So like a static stretch, no good, no end range of motion. We're not moving. And the same with like using the roller or some of those tools initially before you work out, because you're relaxing it, you're turning it off, you're stretching it, but there's no strength there.
Right.
Make sense?
Yeah.
And the other component is if you guys if we do the cool down. So we talked about how when muscle fatigues, it gets tight, it gets knotted up. You work out really hard, you jump in your car, you drive home, you get out of your car, everything is tight and stiff because you just went from that muscle working really hard to being in one position. So now that muscle is an end range, short range of motion. So when the muscle is inhibited or it's not getting the nervous system communication, the nerve is not regulating how short or long the muscle is. So it's going to, if you put it in a short position, it's going to want to get short and get stuck.
Right.
That's why it gets tight. So if you re-educate the nerve to start controlling the amount of contraction, now you don't have the muscle knot and the tightness anymore. So if you do full range of motion cool down and facilitate normal contraction, just like I said with the study, if we can increase your strength 15%, right after working out, we just decreased your time of recovery.
Which that's awesome.
Totally makes sense.
Makes sense.
So you were talking about your technique, your manual technique. So what if, like, we go to regionals or competition setting and you're warming up and you're doing something and you're like, yep, that muscle is not working. Is it possible to do it to yourself or use a lacrosse ball if you know the point you're trying to, like, in that setting where like it's go time or it's that something's turned off? Is there a way to do that?
So we talked about a couple of the easy isometric things that I gave you guys. You don't need equipment. You don't need any room. If you're standing waiting for your partner to get through their reps and you feel like your low back is tight, I gave you some tools to use as you're just standing there. So that will just re-kick things back on.
Oh, right.
Okay. So that's the stuff that you want to use. Or like if I've got like a girls softball player and they have a big tournament and they've got 2 hours in between, or they've only got like a half an hour in between games and they're like, I don't have time to go through my whole warm up again. I was like, okay, well if it's this one thing that's giving you a problem, here's the tool to get rid of that problem. The other thing is, I just had a patient that went on a backwoods ski trip where they drop them off in a helicopter in British Columbia for like 7 days. Well, after the first day, and it's backwoods skiing, so they have to ski up to the top of the hill and then ski back down. So just brutal workout. So after the first day, he woke up the second morning and could not move. His low back was all knotted up. His hip flexors were just like steel rods. He said, I couldn't even stand up. So I rolled and I used the lacrosse ball, and there was somebody there to have him give me a massage. I was like, that's fine. I mean, after day 1 of a 7-day, what are you going to do? Just sit in the hut for 6 more days and be miserable? If that's what you have to do to get loose and get going, then go ahead and do it. So that he did what he needed to do to get through that. When he got back home, he called me and said, hey, I know I'm screwed up. I need to get back in.
How does massage fit? You were just talking about that. So how would a chiropractor, how would a massage?
So if somebody is, if we got a patient that's just dead set on, I got to get a massage, I'll just say, okay, that's fine. Just make sure you schedule with us after you get the massage, because they're going to turn things off. We're going to turn them back on. No problem.
Gotcha. I know for sure for me with the overhead stuff, I have, you've given me some stuff, and I have some other exercises that I think are really good and similar to what you would want. But man, when I get a deep massage and I do that, man, I'm wide open. I feel great.
So then the important thing is, if that's what you want to do, the important thing to come back to when you warm up, if I'm not going to see you, the important thing to come back to is go through those isometrics, go through how we talked about, bar up over top and doing isometrics, trying to pull, or the band, try to pull back and facilitate lower trap. So if they were really working on getting this stuff to open up, first I would come back and make sure you do.
It's firing.
Yeah, make sure everything's firing.
You said something that I thought was really interesting. You were talking about making sure that muscle is tight.
Yep.
Mm-hmm.
And so when after I finish that, if I come out and do something, it's not tight. It actually feels pretty loose.
Right.
So when you snatch and you get that weight up over your head, woo, it's not strong.
Yep.
As I'm thinking back about it, I feel really loose and I have good range of motion.
Right.
But so we want to tighten that back up, and we want to make sure it's strong, so you're ready for that weight.
Right. Because so the key with the tightness is you want to be tight on both sides of the joint. So it's a give and a take. It's not one side takes everything and the other side just lets go, because then our joint kinematics are all screwed up, and that's how you wear out discs and cartilage and all that kind of stuff. So with that stuff is just make sure that you feel tight. So I was working with a Division I receiver the other day, and he did the single leg squat and said, yeah, I feel really loose on this one and I feel really tight on that one. So I didn't want to coach him. I was like, okay, so which one do you prefer? And he said, I want to be tight, which is exactly right. So if you're an athlete, you need to get in and out of position fast. If you're doing overhead lifts, you need to stabilize that lift like now. You don't have time when you get that snatch over top for your shoulder to contract and it's going down and doing this, and all of a sudden we blow a shoulder out.
Right.
When you get that weight up over top, boom, it's now.
Right.
So that's what I talk about when I'm talking about tight. So you want to be a Ferrari that's responsive and tight with everything, not an old farm truck that's sloppy and loose.
And the key is that in terms of the past, tight would mean I don't have full range of motion.
And we're not talking about joint tightness.
Right.
So I don't want you to lack range of motion, because if you lack range of motion and you only get it here, obviously.
Solid, not tight.
Right.
Solid.
Right. We're not talking about that contracted feeling you feel where your muscles are after you've got done working out.
Right.
We're still wide open.
So solid would be a good.
Solid.
Yeah.
But, and so back to the massage thing, I'm just curious too. So, I mean, obviously we beat ourselves up a ton, and there are times that, I mean, your muscles, your fascia, you have so many knots, it's so, for lack of a better term, crinkly, and you're trying to smooth this out because, I mean, your muscles feel physically upset.
Right.
So are you saying that if you fix your movement patterns, you're never going to end up being in that muscular state? Because, I mean, there's still, I feel like.
So no matter what you do, so I just worked on you. No matter what you do, I don't care how compliant you are with the stuff that I gave you, it's still going to eventually turn off.
Right.
So you're still going to, I mean, you're doing CrossFit. You're going to get them. If you're not getting sore, then you're not working out hard enough. Mm-hmm. So that stuff's still going to come back. That's why so your like home checkup program is to do your warm up and your cool down stuff. So that keeps things in check. So if I've got somebody who's a repetitive use athlete, like a pitcher, I want to see them before the season. I want to see them like mid season. I want to see them after the season. And that's if they have no pain and no problems. That's just to keep things going. In between, they're doing their band work. They're doing their active warm-up and cool down and all that kind of stuff. So there's no way that I can treat somebody and say, for the next 2 years, you're solid.
Right.
So it's always something's always gonna happen. And the massage thing is the same as the stretching thing. So yesterday I want to demonstrate on Rich what happens when you stretch. So I stretched his quad for 10 seconds, and he could do absolutely nothing. Yeah.
Nothing.
Yeah. Totally shut the whole thing off. And knee pain, boom, back now. So some people are really sensitive to this. So I told Rich, if you stretch, you are an absolute disaster. Other people I can stretch and they can kind of hold it a little bit. So
No yoga. No regular yoga.
I didn't want to do
Has to be
regular
flow.
yoga.
Has to be flow.
That's the only. I don't do regular yoga. I'm not that patient. My only thing was I was just saying that like just personally, like after a massage on really beat up muscles, I feel better, and I just smoothing out those knots has proven to help me with mobility and longevity in that regard. So I just didn't know if I continued to do that to help for those pieces of it, I just have to reactivate, or you just don't advocate it at all.
No, I mean, if that's something that you do and you enjoy, and that's kind of like your treat for yourself, or that's something that that really keeps you in check, and I'm going to be coming down the next week or whatever, then go ahead and do whatever.
Or you do all that, and then you go through, because you're not here, so you go through the protocol, get things reactivated, and making sure you're ready to compete.
Right. Yeah. And the thing you can do, I tell this to people all the time, is if you really want to do that, check what you feel like before, check what you feel like after. If you go through, go do your massage, and then go do the squat like we did it, do the single leg squat like we did it, go do like a light run or something like that, and you feel loose and things are like, that's telling you that you turn stuff off too much.
Right. Okay, that makes sense. So if you just, we'll go with the athlete demographic. What's your advice to athletes? Like, do you have 3 tips or anything in terms of helping them with longevity or taking care of their bodies? Do you have any tips, or like you came to us today and you go, these are the 4 things that I would tell you guys to always do.
Okay.
Do you have anything like that you could share?
So with the athletes, and the good thing is the majority of the elite athletes that I see, or the college athletes that I see, they have already got rid of stretching and all that kind of stuff at school. So I don't have to go through the whole stretching thing. They're already doing dynamic warm-up, active warm-up, all that kind of stuff. With them, I've got to say, you have to take this seriously. There's a reason why they're doing this with you. If you're a college athlete, this is your career that you're screwing around with if you want to play grab ass during active warm-up time. Okay? So pay attention, do that stuff right. Anytime you feel like you have pain, don't get so focused on the pain that you forget about what caused it. So if I did this and it felt like this, that's telling you that whatever that was, you weren't stable. You weren't ready to do that. So go back and think, okay, what do I do in my active warm-up that I could do to remedy that symptom that I had? So don't think of the pain is here, I need to pick on the pain.
The goal is not to necessarily mask the pain,
right,
and make it feel better. The goal is to get to the source of what the pain is.
So here's a really typical one: plantar fasciitis, foot pain, bottom of the foot, and typical PT chiropractic massage treatment would be just mash on the plantar fascia, stretch the gastroc or the calf complex, night splint, ice, all that kind of stuff. We do none of that, and put somebody in an orthotic or a shoe insert. We do none of that. We take inserts and throw them away. The problem is the anterior muscles of the shin, the tibialis anterior, is usually the problem. So if that's not pulling your foot up, especially most of those people will say, when I get out of bed in the morning, it's like I've got a knife in the bottom of my foot. So if you get out of bed, you're sleeping and your feet are relaxed all night long. So they're in a plantar flex position. When you get out of bed and you force them into dorsiflexion, you're ripping all that tissue that's on the bottom side. So if you get the front side or the tibialis anterior to contract by doing really easy exercises that we give people to do in bed, you can get up and not have foot pain. And you're not stretching. So basically, if you're getting this to contract, this stuff elongates, takes the pressure off your plantar fascia. You're not wearing a shoe insert because we don't want to mask the pain. We want your feet to pronate and supinate. So that's a really good, easy example of, just because you have pain here doesn't mean you go pick on that tissue that is painful.
Mm-hmm. That makes sense.
Yeah, it makes perfect sense.
Wow. What is I had plantar fasciitis for a long time, by the way, and I had orthotics. That's the first thing they gave me when I went to college to run. They were like, oh, let's look at your feet. Oh, you need orthotics.
Yeah.
And you're the worst plantar fasciitis ever.
Yep.
What is the most prevalent injury you see in athletes that you think could be avoided through the protocols and things that you're discussing?
Gosh.
All of them?
Yeah, pretty much. Don't want to say everything, but pretty much everything, because everything stems off of that whole concept of motion stability. If you have motion, if you have strength, and you have stability, it's really, really hard to get hurt, except if you've got some kind of blunt force trauma.
And you can't solve that problem. We sent you like hamstrings and quads and guys with calf problems. And
Hip flexors just mystify people for some reason. So real quick exercise, hip flexor pain would tell you to think of what is not turning on. Glutes. So people that have hip flexor problems and they're sprinting and doing all that stuff is because their glutes not facilitated and their hip flexor is doing way too much.
So if you're not good at L-sits, then
Glutes and back.
L-sits being you're raising the legs up.
Just sitting. Yeah, sitting basically.
like holding your legs up.
Well, that
could be weak.
I was getting ready to say, maybe you're just really freaking weak.
Your hip flexors could be weak.
Yeah.
You said you're not good at them.
I wasn't saying me necessarily.
I know what you meant.
Well, we already figured out what your problem was. So now if you go do L-sits, that should feel a lot better.
Yeah, absolutely. Oh, that's true. I'm going to go try some L-sits after this.
Right.
Because I am. How do you feel about knee sleeves?
She just lied.
So knee sleeves, tape, that kind of stuff, if you're wearing that because you have pain that you're trying to mask, you're basically masking the pain. So that stuff, and actually I'll have a blog post coming out here pretty soon that I've written half of on tape. So what that stuff does is overloads your proprioceptors.
You're talking KT tape, like that kind of tape?
KT tape, rock tape, Kinesio tape, whatever you want to call it. That stuff in sleeves, what they're doing is they're overloading the proprioceptors, which are in the skin. So those feel pressure, they feel the compression of the sleeve or the tape, whatever it is. So that overrides the pain response. So you might feel better, but you're not any better. You're just covering it. It's like putting BioFreeze or something on and then just going and working out. So once again, if you've got a really big meet or something like that coming up and you have to do it and there's no way to fix the problem and it's worth it to do it, then you do it. If you're wearing knee sleeves, because I mean, some people wear knee sleeves just because it's more of a mental thing. Like I like the comfort, that kind of stuff. I'm not trying to mask something. Right. So okay,
so is that
go
the same
ahead and
for patellar tendonitis too? The people that put the like the little bands around the
those aren't good.
But okay, that's the same.
That's a little bit different. Yeah, they're basically saying that if we put compression on the patellar tendon, we lengthen the patellar tendon, and not a good idea.
So I have a couple myths that I saw that I was interested to hear your perspective on. People being, quad dominant or hip dominant. Is that real? Could be.
You've got to put them on. You got to screen them, put them on the table, and figure out if that's what. Like with Rich, he likes to be externally rotated and abducted at his hips when he squats. So, do I come in and say, "Oh wow, you're really hip externally rotated dominant. We need to break that"? No, he's actually pretty good at what he does, so why would I take that away from him? So, but we also know that his knee's getting worn out. So if it's always in that position, that's a problem. So after we get things to fire, and what we figured out with Rich is that he's not externally rotated because he can't internally rotate. His internal rotators are perfectly fine. He just doesn't, he just likes to be comfortable out here. So what I told him was, what you need to do is, on your warm-up and cool down, you really need to work on hip internal rotation, getting through the full range of motion so you don't start losing range of motion, and then you start wearing out the hip too. So with his, and when we did the karaoke with the squat, he cheated the whole time, the first time he did it without me coming over.
Rich is a big old cheater. Knew it.
I compensated.
Yeah, compensated.
He cheated. He just called you a cheater.
But it's super interesting though, because you went right to what you had to do to make that work for you and feel right and feel better, which actually was hurting you in the end. Because am I tracking right?
Yep.
Yeah, because I was externally rotating on those instead of keeping either neutral or a slight internal.
You wanted him right over that leg, straight over that leg.
Yep. Yeah. And we figured out some things that he can do accessory-wise, where he's less hip internal rotation, which puts the stress on a different part of the knee, so he can actually still work out, and that's less pressure on that bad part of the knee. Next myth. Is deep squatting actually bad for your knees? So I just had a post about this too. So,
yay!
Yeah. So no, squats aren't the problem. The problem is that you can't squat correctly, or you can't facilitate to get in and out of the position. Yeah. Yeah. So there's not. So when people say that exercise, any certain exercise is bad, I just thought of a bad exercise, so I better not say that. So, so exercises that are active, that are going through a range of motion, if somebody tells you that it's bad to do that, it's because they don't understand that it's about how you contract to get through that exercise. So you go to Ethiopia and hang out and watch those people deep squat all day, 18 hours a day, and tell me that deep squatting is bad for your knees.
Mm-hmm. Where did that come from? How did that end up?
People that didn't want to squat.
Yeah. People who hate squatting.
It's like lifting weights stunts your growth.
Yeah, I mean.
No.
So can you talk about that real quick too, for maybe someone who didn't get to see you do it? Like you say, go through end range. What does that mean?
Yeah, that's good.
So what we talked about is called the recipe for injury. So one of the ingredients for the recipe for injury, one of the things that you have to have in order to have an injury is end range of motion. So if I'm sitting here right now like this, I can't tear my rotator cuff because there's no stress on my rotator cuff. So if I have a piece of paper, the only way I can tear the piece of paper is to max it out and do that. Okay, so that's the end range of motion. So end range of motion with your joints is how far can that joint go and still be healthy enough to get out of that position and come back. So we don't want you to be tight joint-wise, even though we talked about tight muscle-wise. We don't want to limit range of motion in the joint because that keeps you from doing the whatever the activity is that you're trying to do. So we want to open up as much motion as we can to get to as far as we can. Now, the problem with a lot of the stuff that really pushes mobility out there is there's no answer to how much range of motion is enough range of motion. Like, I don't know, just keep on forcing it, keep on forcing it, keep on forcing it. So then you get hypermobility, which we kind of talked about yesterday too, is it's a lot harder to get somebody who's hypermobile to be stable than it is somebody who's tight to get full range of motion. So hypermobility is harder to control. Can you say that one
more time? It's harder
if I've got a gymnast that's just joints are all over the place, it's harder for me to get them to teach those muscles how to fire through that huge range of motion than it is to have somebody who's got a tight shoulder. It's really easy for me to get Jim to get back to full range of motion. All I have to do is turn on the things that are turned off and he gets to full range of motion. With the gymnast, she gets way the heck back there and can't stabilize anything. So now it's harder for me to teach her how to stabilize that stuff.
Okay. Makes sense.
Basically, you're saying you want control throughout all range of motion.
Right.
Yeah.
So as long as you have give and take on both sides of the joint and all those muscles that surround the joint are contracting equally, and so if this muscle is going to contract 5 pounds, this muscle needs to contract less 5 pounds. So as long as there's equal give and take, the joint stays where it's supposed to. You're not banging on the joint, wearing out meniscus and labrums and all that kind of stuff.
So one of his big problems prior to now is inflammation.
Yep.
So he was having all kinds of problems with inflammation, and you talked about inflammation is the big enemy, whether it's through diet or you've had some sort of injury or something like that. So prior to you getting here, you were able to, with some of the stem cell stuff and some of the other things, get rid of some of that. So we're getting rid of the inflammation, making that happen, and then we're making sure that all these muscles are firing with a full range of motion.
Yep.
Okay, myth number 3.
Okay.
Does heavy squatting or heavy load compress your spine?
If you're doing it incorrectly, I guess.
I mean, if you
if you're
put
not,
like, I was going to say 300 pounds, I wish. 200 plus pounds on your back and you go into a squat, like you stand up and you're like, oof, feeling pretty, but is that just your mind, making you think that because you were just holding a lot of weight, or
well, your spine compresses as the day goes on anyway, just sitting around, walking, standing, all that kind of stuff. So the fluid in your discs as the day goes on you'll lose fluid, and that will compress. So if you're going to put weight on your back, I guess that would increase that. But if you're facilitating trunk and spine stabilizers, those should be stabilizing your spine. So that should keep some of that pressure off of the discs.
Gotcha. That makes sense.
Yeah.
I'm going to ask him about
You misspelled Taja's name, by the way.
I did not.
Yeah, her name's misspelled on your phone.
How do you know?
Because I just saw she texted you.
Oh. No, I didn't.
You spelled it. Yes, you spelled it.
How do you spell it?
V-I-C. You spelled it V-I-C.
Oh my gosh. Okay.
Wow, I can't believe you
Anyway.
screwed that up.
No one's name his name has 2 N's in my phone.
Yeah.
Anyway.
What?
F-R-O-N-N-I-N-G.
I've since fixed it. Thank you. It's a real test. If you have a nickname in my phone, then you're like really high on my list. If you
What is my name in your phone?
Jim Silver?
I haven't changed it yet, but I'm going to change it to
See,
Silver
none
immediately.
of us have.
You have a nickname in
What
my
is
phone.
it?
I'm not telling. I have a. Let me finish this real quick.
Oh, sorry.
I want to ask about the Batman boots. Sometimes you walk into the barn and Rich is.
Oh, he's
hanging upside. You really do look like a bat. Anyway, how do you feel about this?
I wouldn't do them very long.
But
I just text her.
Oh.
I can't see it.
it says big turd and there's little poop emojis.
Oh, really? Wow.
That's not what it is.
It's
but
fitting.
There you go.
It's just a line of the smiley face turds that come up when he texts.
Oh, that's hilarious.
I'm just kidding. No, it doesn't.
So you gravity boots.
Gravity boots.
Batman boots.
So same. I wouldn't spend a lot of time there.
You've been hanging upside down for a long time.
It's like 5 minutes in the morning, 5 minutes at night.
You just walk into
Okay.
the bar
I was
and
just trying to
you're
move
hanging upside
inflammation.
down.
That's really what I was trying to do.
Yeah, and as far as and you've got the pneumatic cuff too.
Yeah,
so I would say that's
Robotex,
better
use
than
those
doing.
better?
Yeah.
Okay. There we go.
So that was it.
One last question now. Use it good.
I know. I had a good
Spend
one.
it
I was
wisely.
looking for it because I'm going to butcher it if I say it the wrong way.
Probably.
So this question is usually asked like what can you do each day to create long-term predictable happiness? But I'm not going to ask you that. I want to incorporate it to what you do. What can you do each day to create long-term predictable health, from a PT standpoint?
What's something you could do every day
Yeah.
to try to stay healthy?
Thank you.
So move is good. So get up, move around, especially if you got like a desk job. Getting up and moving around, even if you're dysfunctional, is going to be better than sitting there all day. So get up, move, exercise. For my patients, we try to get them. So if somebody comes in and sees me and they're a disaster and I give them 4 exercises, I'll say, I want you to do those 4 exercises like 5 times a day. So the more you do the exercise throughout the day, the more you remind the muscles to stay on, the body works, you break the compensation. So what I tell them, once they're pain-free, I was like, you don't need to keep doing this stuff 5 times a day, but if you can do this like first thing in the morning, make that your little 5-minute morning get going routine, that's a good way to start the day and just get things kicked on so you're not rolling out of bed and being stiff and all that kind of stuff. Which reminds me, we talked about cheetahs and leopards yesterday too.
Cheetahs.
You've never seen a cheetah or a lion stretch before it takes down a gazelle?
That was kind of
Zombieland?
Yeah.
Yep.
That was interesting.
So if you watch your dog at home, when they are done sleeping, what do? They get up and we say stretch, but they're actually not stretching. They're doing isometrics, which is the same stuff that I gave you guys. So they know once they get in that position and squeeze those muscles and squeeze, that turns them back on. They're like, oh, okay, now I can move around. So if you do the same thing when you get out of bed in the morning, you'll be like, okay, I feel better and I can actually get going throughout the day without being dysfunctional.
I always think it's hilarious to see a dog do downward dog. It makes me laugh.
It's
every
crazy
time.
because it's intuitive to the animal. It's
Downward dog does it.
Awesome. So if they want to find out more about you, about what you do.
Yep. So website is the180system.com, and it's spelled out ONE80. So THEONE80 system.com. You can find us on YouTube, Instagram, and Facebook. Same thing, the 180 System.
And that's where your blog is too?
Blog is there.
Go read those posts now.
Videos. So the 180 System material is geared more towards professionals that we're trying to get into classes. So they can find, if they go to the 180 System homepage, there's actually they just register for an email and they'll get a series of, I think, 6 or 7 videos that break down exactly what I did with you guys.
Oh,
so
awesome.
this is what we want to teach people how to do. They can take a quiz at the end. It's good for 1 CEU. So if you're a physical therapist, chiropractor, whatever, and you want to CEU and learn more about what we can do, that's all on the website. YouTube channel has testimonials from everything from, I've got a patient who's a Radio City Rockette all the way to an elderly guy that came in for a foot problem, and we figured out that he actually had a hip and a shoulder problem. So all that stuff, anything you want to look up is on the 180 System.
awesome.
Thank you so
Awesome.
much.
Yeah,
Thank you. Thanks for coming.
Yep, thanks for having me.
CrossFitMayhem.com, FroningandFriends.com.
And we have it.
There we go. Peace.